Thank you, Mark. Good morning. Thank you all for being here today. My name is Jared Heimlich. I'm the Executive Director of the Mayor's Healthy City Initiative, and as Mark said, I'll be your MC today. And so I first want to welcome up Dr. Kerwin, who's going to give a welcome.
Thank you, Jared. Good morning, everybody, and welcome to Pennington Biomedical. My name is John Kerwin. I'm the CEO here. We're delighted to host you today for this exciting Community Health Needs Assessment press conference. COVID-19 clearly demonstrated the need for this key strategic plan, as well as the importance of collaboration among our health district members and our policymakers. And Pennington Biomedical is proud to be a part of both of these vitally important initiatives. Like a lot of you in the health space, Pennington focused a great deal of its resources on the coronavirus over the past 2 years. For example, we worked with the Mayor's Office and Health EBR on Go Get Tested, an effort to reduce the barriers to testing in underserved communities. And we also collaborated with Ochsner Health to analyze data from coronavirus cases to find out what factors increase the odds that a person would be infected. We're currently working as part of a consortium as leading the state's biomedical institutions to investigate the mysteries of long COVID, which many of you will have heard about. This is part of a National Institutes of Health Award. Pennington is one of 25 research institutions nationwide that will examine why some people are still sick months after being infected by the virus. These are just a few examples of the role of our research plays in public health. We're proud of our partnerships with all of you and our work to ensure that the residents of Baton Rouge and the world live healthier, happier lives. Thank you all for being here today, and now I'm going to turn the podium over to Mayor Broome so that we can hear about the successes and the future plans for Community Health Needs Assessment. Thank you.
Thank you, Dr. Curran, and Jared, for all of the work that you do, and for all of our healthcare providers, partners, supporters who are here today. Really appreciate your presence. So today marks the second time our administration has worked with our hospital partners to release a joint community health needs assessment for East Baton Rouge Parish. Now, I'm excited to talk about the CHNA, but what I am even more excited to talk about this morning is the relaunch of our website, healthybr.com. In the past 2 years, we've learned a lot. It's the importance of each of us understanding our health and how to navigate the healthcare landscape. COVID-19 has taught us a lot, and our partners have done an amazing job at compiling information all in one place. The healthybr.com website is going to be a one-stop shop for all things health in Baton Rouge. So, if you will, let me walk you through some of the aspects of the website that I am most elated about. I'm most excited about our community resource directory. Now, this new directory will initially include behavioral health resources and will expand to include resources from our Ending the HIV Epidemic Commission and our Maternal Health and Infant Health Coalitions. As you can see, there are a lot of resources here that our community and our partner organizations will be able to access in one location. You can look for inpatient and outpatient services. You can also search for organizations by gender, age, or special populations. You can also see if an organization is located near public transportation or if they provide public transportation. You can view the types of payments that they accept, and even there are special criteria such as a referral from a physician. This resource directory could not have happened without members of the Behavioral Health Task Force, like Charlotte Claiborne with the Bridge Center, and Addie Duvall and Kyla Parks with START Corporation. It is partners like you that will help us create a community that is healthier for all. I also want to thank my friend Padma at Informatics and her team at Vinformatics, who not only helped us create this custom website, but helped us develop this amazing resource directory. You can view the directory by visiting healthybr.com/resource. Thank you once again to Padma and the team at Vinformatics. Now we know that we can't reach every organization, so we need your help. If you are an organization or you know an organization who is not listed here on our website, they can visit healthybr.com/register and add their information to our resource directory. Again, that is healthybr.com/register. Another exciting part of this website is our selection of healthy recipes and video cooking demonstrations. Through partnerships with the LSU Ag Center, American Heart Association, and Pennington Biomedical Research Center, the new healthybr.com website will be a source of seasonal healthy recipes that will include nutritional facts and video cooking demonstrations that people can follow along with at the comfort of their own home. You can look for the budget-friendly recipes, 30-minute meals, or even specific recipes for people who have diabetes or heart health needs. As you can see, most of our recipes not only include the ingredients and the directions for someone like me, but nutritious facts and videos that you can cook along with. I had the opportunity to go very thoroughly through this website yesterday, and I was very pleased at all the content that is being provided. Talking about videos, being active is almost as important aspect of being healthy. That is why the new healthybr.com website will provide access to free fitness classes online. And where you can find free events and classes in our community. The new website will also host recorded sessions of our Family Fitness Rock events. Family Fitness Rocks is an hour-long workout. That's okay. With music that families can work out all together. So this class is taught by 3 different instructors: Tanya Chapman-Griffin, Adrian Brumfield, and Chelsea Morgan. Each of our instructors focus on different types of mobility. For people who have limited mobility, there are exercises that you can do in a chair. There are exercises that are low impact and also high impact. There are classes that highlight different types of physical activity, such as dance, martial arts, kickboxing, and more. Now, the last aspect that I'll highlight for you today, even though I could go on and on, is our community calendar and volunteer opportunities. Here we hope to have our community use this one-stop shop for healthy events, classes, and training on a wide variety of topics. We need everyone's help. If you have an event, your company, your organization, your group, if you're looking for volunteer opportunities, you can visit healthybr.com/volunteer and register to volunteer with one of our partners. Again, for volunteer opportunities, you can visit healthybr.com/volunteer. I know our community has heard me say time and time again, but in order for our community to be a safe, hopeful, and healthy BR, websites like this are going to be vital. We need to ensure that information and resources are easily accessible and attainable for all of our residents, from healthy recipes to where you can access mental health services to where there are bike paths near your house. All of this and more can be found on our new healthybr.com website. Now I'm going to turn it back to Jared, and he's going to introduce our hospital partners who will take a little bit more time talking about our health priorities and what we are doing to address them. Thank you so much for being here today. Jared?
Thank you, Mayor. So as Mark mentioned, I'm going to walk you through a little bit more detail of the behavioral health database. So as you can see, right at the top, you're going to be able to put in either your address, where you live, or your zip code that you live in. So we went in and put in City Hall to find resources that are around downtown. So you can see, you could either type in your whole address or just a zip code. And then from there, you'll be able to search. And so this is our resource database here. And so right now we only have behavioral health, but our maternal and infant health and our HIV coalitions are also working on these resource directories. Here you'll notice this is a very intentional list of behavioral health services. So you may see some names that be like, why ASAM, right? Well, what we did was at the very bottom of the page, we actually have definitions. And the reason for this is that multiple users are going to use this. It may be your resident who's looking for services for themselves or a family member. It also may be a social worker or a case manager at a clinic or a nonprofit that wants to refer someone to services. So this resource will be used for both of those. You'll also notice that there's this search function. And as you add more will show up on the map. So you can see where the location is compared to where you live. And you can see it's a holistic list of partners. Dates and times of when they're available. And then you'll be able to go to a specific partner. So here we went to the lake. And you could see very detailed information. What kind of payments do they receive? Do they have referrals? Do you have to have a referral? And so there's a lot of different resources that are going to be able to hear that's in this one-stop shop. But the most important thing is we want everyone to have access to this. So we'll be working with our other partners like 211 to ensure that they have access to this same information, and we'll be updating this on a quarterly basis. So again, this is the community resource directory. Right now it has behavioral health, but we plan to expand it over the next few months. So now we're going to talk about the community health needs assessment. So each of our healthcare leaders are going to come up and talk about a different area of focus for this community health needs assessment. And so first I'd like to turn it over to Dr. Cliff Moore with Women's Hospital.
Good morning, everybody. Good morning. Thanks for having us here. I'm Cliff Moore. I'm the Chief Medical Officer at Women's Hospital. Some of my background training is I'm also a high-risk pregnancy doctor who deals with pregnant women on a daily basis. It's very exciting and very inspiring to see everybody here working together. I've been assigned or been asked to talk about maternal and infant health as it's been identified as one of the health needs assessment priorities. Here's why. In Baton Rouge at this time, the infant mortality rate is twice as high as it is anywhere else, or on average in the United States. We have more babies die here than most places do. To put it in perspective, if we could just get to the average of everybody else in the United States, we would save 125 babies a year. That's where we are on our mortality rate. Why is our mortality rate so high? Well, one of the reasons our mortality rate is so high is because we have babies that are born too early and underweight. In this community, 12% of the babies are born of what's called low birth weight, and you compare that to the national average of about 6%. Why are people born early, and why are these babies coming to us? Is because one big factor is actually the lack of health care. At this time, about 1 in 4 women that deliver in our region doesn't get adequate pregnancy care. And so those are the challenges that we have in front of us. And so we've been working together and getting part of the mayor's group here and try to address these issues. And so we, along with other people in the region, have launched the Maternal and Infant Health Coalition. Its goal is to increase the education and the awareness of what's going on in our community. Together we are collecting and analyzing data. We're examining social determinants of health, and we're finding ways for women to have better access to prenatal care. Each hospital is kind of looking at their own practices and trying to find ways to improve, and then bringing that back to the group as a whole. One of the programs that we're really positive about at Women's Hospital that most people may have heard of is what's called the GRACE program. The GRACE program is designed to help take care of women with opioid dependence in pregnancy. We know that these women deliver early, and they also deliver babies that are of low birth weight. This program was started a few years ago. We've enrolled over 200 women, and we're showing the improvements in the length of pregnancy and also in birth weights. We're taking this information and we're passing it out to everybody how we do it. But not only is Grace program focusing on opioids, but we're now about to start looking at other addictions such as alcohol and illicit other drugs. So. The other thing that we're working on with the coalition is we're talking about babies that actually are dying just from sleep positioning. We've been part of a task force where we're looking at sleep-related deaths. This is something that's actually easily preventable. At our hospital at this point, we are educating all the ladies before they go home about how to position their babies before putting them to sleep. I will tell everybody, you can do these things individually, but when you start working together with the community, that's where the real effect occurs. We've been working with programs like Healthy Start from the Family Road of Greater Baton Rouge as a resource to help these ladies. I tell everybody, we can get together and we can all talk in a room about what we're going to do, but the real key is getting out to the community. And so we at Women's Hospital is trying to do as much as we can to interact with everybody around to kind of bring this together. I'm very happy to be part of this group and look forward to all the initiatives that we can work together. Thank you.
Awesome. Thank you so much. And as Dr. Moore said, you can see that there is intersectionality between maternal health and behavioral health. So now we're going to have Paulette Barrett with Our Lady of the Lake come up and talk a little bit about HIV and behavioral health.
Thank you, Jared. But as you know, I sometimes always don't follow the script. First of all, I just want to make sure that everyone knows the uniqueness of this collaboration that is occurring here this morning. Now, there may be other communities across the United States that produce a joint community health needs assessment, and we were some of the very early adopters of that, and the very first one in 2012. But today, we stand here as a Baton Rouge community as the only community in the United States that produces and commits to a single community health implementation plan. That is a testament to our commitment to a collective impact model of community collaboration. And that is something that every one of you should be very proud of. And the people in our community need to know that that comes with great work. It is not easy. We will compete like crazy as hospitals when it comes to market share and caring for you and your families, but we're going to collaborate like crazy when it comes to our community and public health. So I share that as the introductory comments as to why this is so very, very important. And just as our partners around mental and behavioral health have Mayor Broome's Behavioral Health Coalition, we as the largest acute care provider of mental health services in our community have a commitment to do something that no one else is able to do at this point in time, and that's to produce a workforce for the future. We have a psychiatric residency program within our ministry at Our Lady of the Lake. We produce 8 psychiatrists a year, and research tells us that where you do your residency program, you usually will go to practice within a 75-mile radius. So it is our hope and our dream, and it's our aspiration to continue that to where 50% of the physicians, the psychiatrists that we produce, stay within that 75-mile radius. So it is very, very important that we continue that work to support the great work that has to continue in the community where behavioral health is concerned. I want to also highlight the need for what we call a collaborative approach to primary care and mental health. We will never, ladies and gentlemen, never have enough psychiatrists or psychologists to meet all the mental health needs of our community. I want to say that again. We will never have enough. But in collaboration with primary care, using those two disciplines together to care for our mental and behavioral health patients, we can and will make a significant difference in the community. So when you turn to the 2021 Community Health Implementation Plan and you look at the outline of resources or the goals that we've set, you see the resource directory, which is really very important. But what you also see is the commitment that we, as healthcare providers, will marry mental health with primary care. That is a game changer. So more to come as we implement that across our entire community. The last thing that I would like to talk about, the second one of our priorities, is around our HIV, ending the epidemic around AIDS and HIV. Mayor Broome and the task force have done a phenomenal job of how we move the needle in our community around HIV and AIDS. When we started this journey collectively in about 2015, 2016, we were #1 in the nation when it came to new AIDS diagnoses. That's not a good number to be, all right? #1 like that is not a good one. Doing opt-out testing, increasing our testing capacity across the entire community, we've been able to lower that rate in 2016 from being #1, we brought it down to #10. We only made that much difference in the community by increasing testing, which meant the opt-out testing programs that we're doing in emergency rooms across our many emergency rooms, and as a catalyst working with Ochsner, for Ochsner to then scale up and out for them to do HIV testing in all of their ambulatory settings, emergency room settings. As I said, we are going to compete as healthcare providers, but we're going to collaborate where our community health is concerned. And so that's an aspect of this work that I think is so important that people sometimes miss, is the collaborative nature of how we come together to solve these large problems. And to that end, I say thank you for your support. We have made a significant difference in our community over the past few years, and we will continue to do so as such. Thank you.
Thank you, Colette, and it was a great segue to Ochsner, where we will have Mr. Chuck Daigle speaking about healthy living in our community.
Great, thank you, Jared. Mayor, thank you for your leadership. Jared, thank you. Great to be here. My name's Chuck Daigle, serve as the CEO of Ochsner, Baton Rouge. Also want to thank my colleagues. Coletta mentioned the collaboration, and want to thank my colleagues here and the healthcare providers for coming together to really look at community solutions. Very important for the continued health and wellness of our community as we go forward. In November of 2020, Ochsner launched a Healthy State initiative. And our initiative was really, the drive was to get us out of 48th and 49th on the health status rankings for Louisiana. And really trying to move us to at least 40th. It's a start, to get us to 40th. A lot of work has gone into that. A year and a half since then, we've had a pandemic, but we've made tremendous progress. Again, I want to thank, in no small part, Mayor Broome for her initiatives and her administration, really working from a healthy Baton Rouge to be a part of that collaboration. From the outset, we knew that no single person, no single entity, no single healthcare provider was going to be able to move us from 48th, 49th down to 40th. It takes all of us. It takes all of us in the healthcare community, all healthcare providers. It takes our state and local officials. It takes industry. It takes every one of us in our community to get out into our communities to do the adequate education, to provide the tools necessary to improve health status. In addition, it takes access. It takes access to care and a commitment on behalf of Ochsner and other healthcare providers to move access points throughout the region. In collaboration, we can make a difference throughout our community. As I said, Mayor Broome's administration has been especially helpful. The Healthy Baton Rouge program shares many of the goals and initiatives of Healthy State, encouraging our healthier lifestyles, increasing physical activity, managing chronic disease. Ochsner offers many digital tools that we have homegrown and that we've partnered with companies such as Microsoft and other companies that really have the ability to manage chronic disease such as hypertension and diabetes. We've seen results for members on this technology improve control rates by up to 30 and 40%. Again, preventing emergency room visits, preventing crisis, keeping folks healthy and well and thriving in our communities. In addition, smoking cessation, tools for mental and behavioral health, just to name a few. In addition, we've set out to open community health centers throughout the state of Louisiana. In Baton Rouge, we've made a commitment to expand access to health care. Again, thanking the mayor for her collaboration in opening the Breeze Community Health Center in North Baton Rouge, enabling further health care access for our region. Healthier living also requires a solid workforce. As part of Healthy State, we continue to develop partnerships with Southern, with LSU, with Baton Rouge Parish Community College, preparing the next generation of healthcare workers is incredibly important to ensure access on a proactive and preventative care basis. We've also established the Ochsner Xavier Institute for Health Equity and Research, something near and dear to our hearts, to understand healthcare disparities in our great state of Louisiana. As Healthy State of Baton and Healthy State moves forward in collaboration with Healthy Baton Rouge, it's going to take each and every one of us, again, working together collaboratively. We've got to work towards the same goals. I think the Community Health Needs Assessment reinforces that commitment for us as providers in the Baton Rouge community to come together, to work together. It's a crucial step. We look forward to continuing to work with the Mayor's administration. Jared, thank you for your leadership, and my colleagues, thank you for your collaboration. Thanks.
Thank you. And another great segue is I will now turn around to Edgardo, who's going to talk about health equity and racial disparities in our community. Thanks, Edgardo.
Thank you. Mayor Broome, I thought during your presentation that you were going to do a demonstration for kickboxing or Zumba. I was really looking forward to that, but thank you for your leadership in bringing all of us together to produce this health needs assessment. I'm really proud of this initiative and continue our commitment to identifying and addressing our biggest healthcare needs. As we have said throughout this morning, those needs have changed over time, have developed over time for the last few years as we manage COVID and other issues that came with it and from it. Delays in care, increases in stress and anxiety, and more. And as the newest health needs assessment was being developed, we recognize that in addition to the regular healthcare needs, health equity and racial disparities are an issue that should be addressed, and we should be aware of it as we work together to resolve it. We know, for example, that Black women are less likely to get their annual mammograms on time. We also know that African American patients are more likely to be hospitalized with COVID. And we see these disparities every single day at our hospitals and our physician offices. Health equity is about ensuring that everyone has access to quality care, regardless of race, gender, socioeconomic status, and location of where you live and work. So as part of our plan to address these disparities, we'll continue to work focusing on outreach in traditionally underserved zip codes and in school settings, for example, and by creating more access to care. We're also working with community partners and schools to help meet people where they are. That means mobile screenings, telehealth visits, and partnering with community organizations to provide new resources and access to care for people. At Baton Rouge General, we're very proud of the work that we're doing at Mid-City. We reopened that emergency room and that acute care facility almost 2 years ago, right when the COVID pandemic was starting, and we're working very hard with the legislature and with the Department of Health and with the governor to make sure that that remains a viable alternative and a viable setting for folks who live in the Mid-City area and in North Baton Rouge. Our care initiative is tackling some of the most common issues keeping patients from achieving their healthcare needs and their healthcare goals, from transportation to medical equipment to food insecurity. And we're working with partners like the YMCA, Mid-City Redevelopment Alliance, Open Health, and the East Baton Rouge school system to develop programs that address the disparities that are creating inequality and inequity in outcomes in our community. The great news is that we're not alone. The Mayor's Healthy City Initiative has continued to add more resources and programs in this community. And I know that other hospital partners are just as devoted as the General to make sure that we're reaching these goals for everyone. Ultimately, we all want the same thing: healthy families and residents who will continue to work, live, and thrive in Baton Rouge so that this community could be a guiding light for everyone in the state and everyone in this country. Thank you very much for your attention.
Thank you so much, Edgardo. And finally, our last speaker is Dr. Paulette Rivera, who is our new Region 2 Medical Director with the Office of Public Health.
Thank you so much. Greetings, everyone. I bring greetings to you from the Office of Public Health, led by Ms. Kimberly Hood, within the Louisiana Department of Health, led by Dr. Courtney Phillips. And many of the speakers before me have spoken on the role of collaboration within public health. I'd like to anchor our conversation there. When we think about the role of collaboration in public health, we think about gathering our collective expertise. We think about informing, teaching, inspiring even the next generations of scientists, physicians, community leaders, philanthropists. But we should also think about how we can stretch the span of our view, not only just from disease and disaster, but also to the strengths of our community, to all the positive attributes that allow our neighbors and our neighborhoods. Certainly, as we think about the role of collaboration in public health, we should think about the questions that we must ask ourselves. The first question is, what is our center point? Our work should not only be centered on community, but should be fully informed by our community. We should actively look for caregivers who are not traditionally recognized as such, those who may not be degreed, but who are definitely leaders within their communities and foot soldiers within their neighborhoods. We must surveil the room and ask the question, who's not represented? And we must not only extend the invitation to those, but do so with unfailing regularity and make sure that we platform those leaders, that once they arrive in the room, that there is an equitable space for them at the table and without fail. We must question, how do we move from assessing our community, from identifying problems, to elevating the conversation and driving effective and positive healthcare policy? This is the role of collaboration within public health. So as we pull from our diverse perspectives within our work, I would like us to do what Health EBR is demonstrating, which is unifying on one goal, and that's protecting and promoting the health of our community. I'm so inspired to be part of this project, and I support it wholeheartedly. Thank you very much.
Thank you so much. And so this concludes our press conference. Again, you can view the 2018, 2012, 2015, and the 2021 Community Health Needs Assessment on healthybr.com, as well as the implementation plans that were mentioned earlier today. And so now I'll open it up if anybody has any questions. And we'll also have some of our speakers will be around to answer questions as well. I'll turn it over to Mark.
That's going to be it. We're going to line everyone up in the center here for a picture, a group picture. If the media needs to get any interviews, let us know. We can make that work out as well. And also to the broadcast media, we're going to be sending a press release that includes the